afternoon. Good evening, everyone. Thank you for joining us tonight for this very, very important town hall discussion. My name is Mary Cavanagh. I'm the state senator from Michigan's 6th Senate District, which includes Northwest Detroit, Redford Township, Livonia, Farmington, and Farmington Hills. I'm also the youngest serving female to ever be elected in the Michigan State Senate. And joining me tonight is my colleague and co-sponsor of the Freedom to Plan legislation, State Senator Sen Irwin, and a full panelist of experts, Ms. Brand from Planned Parenthood, Dr. Said and Dr. Tawani, as well as Dr. Klein from ACOG, so American College of Obstetric and Gynecology. Thank you so much for joining us tonight and for our conversation. I just want to give a little background and I'll describe a little bit of how tonight's going to go, and then I'll kick it off to my co-sponsor. So I want to start off by just introducing the topic of tonight's discussion. It's the freedom to plan, and plan what, you ask. Plan a family, plan a future, a life of your own, and protecting our reproductive freedom and expanding access to contraception and ensuring that Michiganders have the tools that are needed to effectively plan for their future families have really been in the forefront of myself, Senator Irwin, as well as the Senate majority for a very long time, even before we took majority last year in January. So that's a little bit of what this town hall is about. Not only in the majority of last year, as well as this year, we were able to remove barriers in several different reproductive health wins, including the repeal of the 1931 abortion ban, the package of the Reproductive Health Act, but we still have so much more to do, and to protect and support reproductive health right here in Michigan. So one thing we're able to do is continue to protect the freedom to plan. So tonight we'll begin by a brief overview of what the freedom to plan legislation is from myself as well as Senator Irwin, and we will follow up with our experts to share their perspectives from their fields. Afterwards, we will take some questions from the audience. You can use the Q&A section right at the bottom just to submit your questions throughout the presentation, and then we'll get them throughout the end, and we'll go through them as much time as we can. So first, I just want to talk a little bit about my legislation. I'm going to kick it off to my colleague. My bill, Senate Bill 973, breaks down the financial barriers to oral over-the-counter hormonal contraception and emergency contraceptives, such as over-the-counter birth control or pills such as Plan B, by requiring private insurers that offer health plans in this state to provide coverage for these types of contraceptives. Each year, about 50% of pregnancies in the US are unplanned. This is often due to lack of access to contraceptive care, and this is especially prevalent in economic disadvantaged communities and less educated groups such as teenagers. Unplanned pregnancies can be life-altering, forcing birthing people to make difficult emotional, physical, and financial choices within their lives. But contraceptives put your choice in your hands, and this option shouldn't be just available to those who can afford it. And removing these economic barriers to access birth control can be really life-saving and allow for family planning to be the choice of the person, and has been proven to cut abortion rates by about 60 to 75% due to really providing that option available to make that decision about your life, your future, and your family as early as possible. Contraceptives remove burdens from offices, from healthcare, all the way to welfare systems, and really offers opportunities for individuals to pursue higher education or further their careers with the ability to plan their pregnancies. So this ability to plan is powerful, and accessing contraceptives is just one step to ensure that family planning remains in the hands of the people that it affects most, as choices about your body remains within yourself and your trusted healthcare provider. So at that, I do want to offer a little bit of time for my colleague, Senator Irwin, to discuss a little bit about his bill.
Thank you so much, Senator Cavanagh. It's a real honor to join Senator Cavanagh and all of you and all these experts tonight to talk about the important work we're doing to continue the fight for reproductive justice. I don't think it's surprising to anybody on this call to say that, in just the last couple of years, we've seen these attacks strengthen in DC, and with an uncertain political environment and everything that we've seen after the Dobbs decision, I think it's all the more important that at the state level, we have this conversation here in Michigan. What can we do to make sure that people in Michigan are protected and to make sure that reproductive rights are protected here in Michigan? And so that's why what we're talking about today builds on some of the good work that the legislature has done ever since the citizens spoke and repealing the abortion ban from 1931, the Reproductive Health Act, and hopefully more. So it's a tremendous honor to be a part of this town hall tonight to talk about these issues. And as Senator Cavanagh mentioned, this legislation taken together really is about making sure that we cover oral, over-the-counter hormonal contraceptives and emergency contraception. Senator Cavanagh's bill covers the insurance code. My legislation covers the law that governs our Medicaid program at the state level. So those two bills together really cover the waterfront for insurance in Michigan and ensure that everyone will have financial barriers to these contraceptive products removed. And so this is important because of all the reasons that Senator Cavanagh mentioned. I'll just, at the risk of reiterating some of them, I mean, it's about preventing unintended pregnancies. People need the tools to be able to plan for their families, and it's essential in that way. It's important to me personally because this is about protecting freedom and equality here in the United States. And as Vice President Harris mentioned during a very prominent Supreme Court nomination, how many of us can think of laws that are out there made to specifically restrict the healthcare choices of men? And so when we have these laws that restrict the healthcare choices of women and put cost barriers in the ways of women, we need to stand up for equality. And that's why this is also important, because it protects all people. And then finally, I think it's important to also mention that these contraceptive products are often used for a variety of different conditions and to treat other ailments. And so for folks who are using these products for those purposes, whether it's to treat endometriosis or migraines or other conditions, these products, if they're useful for those purposes, they should be available to people without those additional cost burdens. So with all that, it's just a great honor to be here with my colleague and with some experts to talk about why this is important and why it affects people's lives and how this could work in the state of Michigan.
Thank you, Senator. And with that, I do want to hand it over a little bit to our experts so we can have some time for questions. I'll start by turning over the floor to Ms. Brand from Planned Parenthood, who will provide a brief history on the issue and discuss legislation in a civil rights context. Ms. Brand?
Thank you. Yeah. First, thank you, senators, for introducing these bills. It's so important in this landscape that we have right now. As most of you know, almost 60 years ago, the U.S. Supreme Court recognized that the U.S. Constitution includes the right to birth control. This right has contributed to individuals' ability to make their own decisions about when and whether to start their families, grow their families, to have that choice. It has improved numerous people's health all across the country by increasing people's control over their reproductive lives and futures, and has allowed them to advance their careers, education, and helps contribute to our nation's economic and social well-being. But as kind of mentioned earlier, the right to birth control is under threat. The U.S. Supreme Court's decision to overturn the right to abortion, and in particular, Justice Thomas's explicit call to also overturn the 1965 case establishing the constitutional right to birth control, opened the door for efforts to undermine this fundamental right. But even before that, access to birth control was under threat, and the constitutional right to birth control was being targeted by a range of policymakers across the country. But after our success passing Prop 3 and the Reproductive Health Act here in Michigan, we wanted to secure our rights even further. Michiganders face a variety of barriers when accessing contraception. People with low incomes, rural residents, particularly in the UP, people living with healthcare deserts, they face some of the greatest challenges in finding providers who can prescribe contraception. And many people encounter unnecessary red tape, such as prescription requirements, prior authorization rules, limits on how many months supplies can be picked up at a time. In fact, here in Michigan, 1 in 3 birth control users say that they've missed taking their pill, which renders it pretty less effective, but they missed taking their pill because they couldn't access their next prescription. So some people are forced to pay out of pocket also as well, if their insurer won't cover contraception or will only cover specific types that don't meet their needs. In a recent study we did, 1 in 4 people using contraceptives report that they aren't using their preferred method because of one of these barriers. Ultimately, contraception is critical to an individual's autonomy, equality, and ability to participate in our social, economic, and political life to their fullest desire. And with, like Senator Cavanagh mentioned, with the first over-the-counter or oral hormonal contraceptive recently approved by the FDA, there's no time like the present than to take some more steps to break down those financial barriers to over-the-counter contraceptive and emergency contraceptives. So the Freedom to Plan Act would modernize our insurance code and make sure that all Michigan residents have the autonomy and power and freedom to make their choices about their bodies and their lives. And I am so excited and thankful for our senators and all of their work on this. And I will pass it off to people who know much more about birth control than I do.
Thank you so much. I think that was really important. Just what you mentioned is that also what Senator Irwin touched on is that there's a lot of different reasons why people are taking all of these different methods, and also how precise that dose is, and every day, and having to be precise to having that prescription, because once you don't have it, it's null and void. And so people, even my friends, are chasing that prescription, chasing those doctors, and it's an increasing barrier just to even stay on a family planning to further your life or further your college, or even just making a choice in what you'd like for the next upcoming life. So I just want to say thank you for that, and I now want to hand it over to additional experts. We'll hear from ACOG experts on how this issue and legislation impacts Michigan patients. So whoever wants to start.
Good evening, everyone. First of all, thank you so much to Senator Irwin and Senator Cavanagh for having us here. It's very exciting to be a part of this panel. My name is Neha Thawani. I am a OBGYN fourth-year resident down in Detroit at Henry Ford. And just kind of wanting to give some clinical context to why these bills are so important. So specifically for 973, it focuses on expanding access to contraception by requiring insurance healthcare plans to cover all FDA-approved contraception and emergency methods, as we've heard about. And why this is so important is because it would help reduce financial and logistical barriers that people already face. For example, patients shouldn't have to think about if their birth control or access to family planning is going to be sustained when they're switching jobs or careers, but they do. Other patients sometimes don't even realize this until it's too late. And suddenly they go from being stable and working for one company and suddenly in another job and being told they're not allowed to be on their kind of life-altering oral contraceptive, and suddenly now have to deal with debilitating menstrual cycles that are getting in the way of their new job and the rest of their lives. 974 specifically would require the publicly funded insurances to do the same. And this is particularly near and dear to my heart because I get the privilege of serving the population of Detroit, and a majority of our patients do kind of fall into this category. Being able to control one's reproductive goals, including managing your own cycles, including managing your own family planning goals, is a basic part of healthcare. It's a barrier we as providers fight with every day, our patients fight with every day, especially when it comes to these two things. And these bills would help build on Michigan's efforts to safeguard access to reproductive healthcare, despite the challenges that we're currently facing. And it would still, I feel like, continue to allow us to be considered that safe haven state that we have so proudly kind of gotten to be in these recent few years. I'd like to pass it on to my colleague, Dr. Saeed.
Thank you. Dr. Saeed.
Good evening, everyone. I'm Suha Saeed. I'm one of the fourth-year residents actually over at Corewell Health in Royal Oak, so a little bit more on the suburban side, but still with the privilege of taking care of a lot of different types of patients. I'd also like to extend gratitude to the senators for allowing us to be part of this panel, because this is a topic that we are all very, very passionate about. I'd like to take a step forward and kind of humanize this issue a little bit by talking about some actual patients and some actual patient outcomes that could have been improved or even prevented had this legislation already been in place. The first is kind of a more tragic example of a patient that we had who was sexually assaulted by one of her relatives and didn't seek care until about a week later when she was sexually assaulted again by the same person. When we asked her why she had waited so long to seek care, she cited things like guilt and shame and fear of the consequences of being seen by a medical provider regarding the circumstances that she had found herself in. When we're talking about emergency contraception, a lot of these medications are really only effective for about 5 days after unwanted or unprotected intercourse, and actually even more effective if given way earlier than that, even within the first 24 to 48 hours. And so this patient was well outside of the window of receiving emergency contraception care to prevent an unwanted pregnancy in this type of a situation. And unfortunately, she did go on to become pregnant. And due to her religious and cultural values, I'm sure you could tell how emotionally devastating this was for her in trying to determine pregnancy outcomes. Had she had access to over-the-counter emergency contraception and especially insurance coverage of that emergency contraception, she may have been able to just go to that pharmacy herself after this incident had occurred and not have to worry about the fear of judgment from medical providers or about the other barriers to accessing that type of care for herself. Obviously, that's a pretty devastating example, but we also see run-of-the-mill patients every single day who would be impacted by this kind of legislation. Dr. Tawani mentioned, patients switching jobs and things like that. Very recently, I had a young patient who had been on oral birth control pills for a couple of years. They had been working extremely well for her. She ended up switching jobs, which switched her insurance providers, and therefore she had to find a new OBGYN to help supply her medications. As I'm sure everyone is aware of, it is very, very challenging to get like a timely doctor's appointment. That's a conversation for another time, but she ended up going about a month without taking her oral contraceptive pills because she just didn't have access. And she also ended up becoming pregnant. It was an unwanted pregnancy. She ended up still carrying it to term, but had she also had the ability to access over-the-counter contraceptives, especially with insurance coverage of it, that might have changed that entire scenario. And of course, there are, the O pill that is one form of oral hormonal contraceptive that is available over the counter. But this is like a very specific kind of mechanism of action that is different than the oral contraceptive pill that she had been on. And so not only did she not even realize that that pill was available over the counter, but it was different than what she had been taking. So she didn't feel very comfortable trying to access that for herself. And so those are just two examples of hundreds, thousands of patients that we as OBGYNs, as primary care providers, other providers are seeing. And these are all people that would be heavily impacted by this type of legislation. So for those of you who are involved in voting on this, on being involved, I really implore you to pay attention to the impact that this legislation would have on constituents, especially constituents who can get pregnant, and the impact that it would have on their well-being, on their healthcare moving forward, and on all of their future prospects, really. Thank you.
Thank you, Doctor. Lastly, I want to offer Dr. Klein.
Hi. Also, thank you so much for having us here to talk about this important topic. And thank you to Dr. Thawani and Saeed for providing the previously mentioned clinical situations. I have the exact same sentiments that they have and a lot of you have today as well. In 2023, O-pill was FDA approved, and it was the first over-the-counter hormonal birth control option available to patients, which is absolutely incredible. It was much needed, and now the time is needed in order to make sure it's accessible to our patients. It's not enough to just have it on the shelves. It has to be accessible to be effective. Just one clinical scenario for myself is I had a patient who is a young mother of 3 children, and she came to see me a couple weeks ago because she had missed her period, and she did purchase Plan B over the counter, and it's not cheap, and it wasn't covered by her insurance, and unfortunately it didn't work for her, and she wanted to get termination, but after having already spent money and already having 3 other children, she didn't have the money for a termination. She didn't have the choices that she should have had. And now she actually has a twin gestation. And so she's going to be 24 with 5 children. And this is very hard on her. Insurance also doesn't cover terminations, but that's a whole nother legislation for another time. But the point of that story was just to say, like, she had already spent quite a bit of money on Plan B, and it unfortunately didn't work. And that money could have also been spent on other things as well. So it would have been very important if insurance could have covered that for her. And like I said, it's not enough just to have it on the shelves. It has to be accessible. It has to be equitable for our patients. I'm an OBGYN. I work in Dearborn, Michigan. Just like Dr. Thawani and Saeed, we share a lot of the same patients. We see a lot of the high-risk conditions that place our patients at risk at risk if they have a future pregnancy, preeclampsia, heart disease and pregnancy, things that can be very high risk and or life-threatening. So access to these medications are critical, and I strongly believe it should be covered by insurance. Thank you.
No, thank you. I think you touched on a lot, and I think all of our experts did, because these options are available. They're just currently not available to everybody. And so I think we need to go and move towards steps on removing those barriers. I myself have a personal story of how I got on birth control was just because of I had really bad periods and cramping, and it was when I was younger and it was parent approved, but the fact that just people don't know some hormonal birth controls can really have a full effect on the body. So if you miss a month, if you miss 2 months, like, it is something that your body feels. It's something that you do have to go through. And luckily, in my family planning, nothing happened that wasn't out of my own planning, but that was a big step. And I had the privilege of being able to have a doctor's appointment and have that family to support. So thank you guys for being here. This is a very big issue for everyone across Michigan, no matter Democrat or Republican. This is just something that Michiganders need to have the option to choose their own freedom to plan. So thank you for being here. I do want to open it up for any questions, and I'll be looking through the chat. I do see some questions coming through. I think one is actually for me first. What products would be covered? Oh, it's actually open for myself and Senator Irwin. What products would be covered under this legislation? So I know we heard a little bit from the experts, and I'd love for you guys to chime in even after Senator Irwin and myself in case we miss anything. From this legislation would cover oral hormonal contraceptives and emergency contraceptives. So we've heard a couple of examples, OTC birth control, O-pill, and emergency contraceptives like Plan B. Senator Irwin or any expert want to jump in case I missed anything?
As far as I know, that covers the waterfront. But I would add one thing, which is that the way the legislation is structured is such that if FDA approves a new product tomorrow or 5 years from now, that would be covered as well. And so it hinges off of that approval. And so now that there are new products coming onto the market, I think it's an appropriate time for us to modernize this law. But we've also built it in such a way where if we can pass it like it's written, it will also affect future products that are available.
Okay, the next question, if this legislation is signed by the governor, when would it go into effect? Senator Irwin?
Well, if the governor were to sign the legislation tomorrow, which of course is impossible because it hasn't passed yet, that legislation would almost certainly go into effect next April. Here in the state of Michigan, we in our Constitution say that laws go into effect 90 days after the end of the session. And so that's probably going to be in about April. And unless, of course, the legislature approves the legislation with a supermajority, then the legislature could theoretically go into effect immediately. But given everything I know about the politics behind reproductive health issues and reproductive justice in general, this has become a very partisan thing. And so, unfortunately, I'm hopeful that we can get some Republicans to support contraception, but especially given how it can affect the rate of unintended pregnancies. But my past experience has told me that we won't get any of their support, and so we'll probably have to wait until 90 days after the end of the year in which it's signed.
Yeah, I would have to agree. I don't think that this would be going into immediate effect or getting enough votes. But unless the legislation is changed through the process, either on this side or in the House, I do believe that the legislation requires insurers and Medicaid to cover certain OTC contraceptives beginning January 1st, 2026. If I can relay it to the experts, is wondering if that is also, would that be the date, even if the governor signed it? That would be the legislative date, would be January 2026.
Yeah.
Getting confirmation, just because I know we've been going back and forth, but I do know that we just put, just in case, because we have been discussing if we had enough votes, but my staff is telling me January 1st, 2026. Great. So going on the next question, this is open to the experts. If there is new OTC oral contraceptives that are FDA approved, would insurers be required to cover those, or only existing OTC oral hormonal contraceptives that are in the legislation, or that when it passes?
So I can take this, but yes, the legislation does include any future, like Senator Irwin mentioned, any future over-the-counter hormonal and emergency contraceptives.
Thank you. Under this legislation, would I have to submit my purchase of over-the-counter oral hormonal contraceptives and emergency to my insurer for reimbursement at a later date? Was a question.
I can tackle
No.
this one.
Go ahead, go for it.
Yeah. So actually, no, which is a nice part of this legislation. So essentially, your insurance plan would actually be billed for the over-the-counter contraceptive or emergency contraceptive at the time of the sale. So very similarly, that you might have to do a copay when you go into like a doctor's visit or getting other prescription medications covered. You would still probably be required to pay some sort of a copay, but it would definitely be a fraction of what the retail price actually is. And knowing how many Michiganders are living paycheck to paycheck and having so many challenges purchasing the things that are necessary for them to live, we are working on essentially breaking down some of these barriers to ensure that over-the-counter contraceptives remain accessible to everyone. Like Dr. Klein was saying, it's one thing for them to be available, it's another for them to be accessible. And so that is one of the goals of this bill, is to increase access to receiving this regardless of socioeconomic status.
And there is a question, I know we heard a couple of examples, but it says, to the experts, can you talk a little bit of how you can see a direct of your experience of someone that might benefit for legislation like this? I know when we kind of went around, we talked about some experiences, but maybe like a direct, if this legislation passes, who might benefit from this and what that might look like in a doctor's office, or we even mentioned socioeconomic, what kind of demographic or population might it help the most as well?
Yeah, absolutely. I can give one example. Right now there are there are a lot of different options that you have for emergency contraception, but two of the most popular and the two of the most efficacious are one medication called Ella, and then the other one is called Plan B. Plan B is the one that's kind of available over the counter, but as Dr. Klein said, this is not cheap by any means. And then Ella is the one that's been considered to be a bit more, significantly more efficacious. And it's actually just kind of like the way that this medication is made and the hormone specifically used. It's able to help a lot more people for a longer period of time. Like Dr. Saeed was saying that, you know, some of these medications only work for like a short period of time. This one has a larger window. However, Ella is not available over the counter and is a lot of the times not covered by insurance. So having the passage of these bills would very much directly like allow patients, a larger group of patients that need emergency contraception, to one, have more time to access them, and two, be able to be more efficacious and more functioning for like a larger group of people, regardless of, for example, what their BMI is, or like how far along after the like unprotected intercourse it was. They're just in like that way, sheer number wise, significantly much bigger impact.
Thank
And
you.
just to,
Yeah, go
sorry,
ahead. No,
just
go
to add
ahead.
a little bit of additional detail too to what Dr. Tawani said when she was talking about, especially with Ella being one of the a very popular prescription only emergency contraceptive pill. One of the biggest things with that one is Plan B is actually not found to be as effective for patients who are overweight or obese, so like a BMI over 25, over 30. And so this being the only kind of method of over-the-counter contraception, women aren't even realizing that they're taking this medication, and it may not actually be preventing them from getting pregnant because it doesn't work as well for them. And so if something like Ella was available, which as we know, the rates of people being overweight and obese in this country are quite high, something else that we're kind of tackling, but we want to make sure that this large sector of, the American population should still be able to access emergency contraception that works for them. And so this is a huge patient population that would benefit from having the other form of emergency contraception available over the counter, and again, covered by insurances as well.
Thank you. And we did have a question on how safe are these and effective OTC products. Can you touch a little bit on that of someone that might be nervous about this being a little bit more available?
I can talk about that a little bit. So when we're talking about contraception, there's perfect use and there's typical use. So the effectiveness of them really can vary. So for the O pill, also sometimes known as mini pill, Micronor, the perfect use is about 95. Upwards, some studies quoted upwards of 99% effective, but I don't believe that. And for Plan B, usage for that, for preventing pregnancy when used within 72 hours is about 75 to 85% effective, somewhere around there. So they are pretty effective. They're better when used perfectly as directed within the time frame. If you're using it for emergency contraception, used appropriately. So it is important that patients do review that information or review it with a pharmacist if they have any questions when they pick it up. In terms of safety, as we've discussed, O-pill is FDA approved, so for over-the-counter use. So we do believe it is safe to be on the market. There's risks with any over-the-counter medications. There's risks with acetaminophen, with ibuprofen. The big concern, I guess I shouldn't use the word big, but the one big concern that we have with hormonal contraceptions is the risk of a blood clot event, which is really, really rare. And the patients who would be benefiting most from this would be usually young, healthy women in the community, who it would be extremely rare to have an event like this. I think it's about 1 to 5 in 10,000 events are expected to occur. 1 to 5 events in 10,000 woman years would be expected to occur. So like I said, it's very, very rare. So this is a very safe medication. It's effective when taken appropriately for the appropriate patient, as my colleagues had mentioned.
If I can also add on to that. So when we talk about, especially when we talk about the risk of blood clot, the other thing to note is that the risk of blood clot in pregnancy and in the postpartum period is much higher than the risk of a blood clot with oral contraceptive pills. And so that is something that is really important to keep in mind, is the risk of these medications versus the risk of an unwanted pregnancy on a woman's body. And so that's one thing that I want to note. The other thing too is that the way that, ACOG supports these medications, especially with a lot of these progesterone containing medications that we have for oral contraceptives, are very safe, and their risk of blood clots is actually pretty low. It's when you add that estrogen component that the risk increases just slightly. But there have been a lot of studies that have shown that when patients look at the checklist for reasons that they shouldn't take it, there have really been very rare instances of people, electing to take that medication who it's not safe for. The vast majority of women are able to self-screen themselves, are able to see if that medication is safe for them and to take it as directed. And so that's talking about kind of the over-the-counter hormonal contraceptives. On the other hand, with emergency contraception medication, so what we were talking about with Plan B, with Ella, studies have actually shown that that the benefit always outweighs the risk. There is no contraindication really to taking any of those medications, showing how safe and effective that medication is for women to be taking it. And so literally there's no, other than what we were talking about with some women maybe, as far as their weight goes, and not being as effective. They actually, all of the studies have shown that its benefits outweigh its risks every single time.
Thank you. I appreciate that background. We actually have one for the senators. So I'll hand it over to Senator Irwin first. As someone who cares a lot about reproductive health, what can I be doing to help this and other legislation get passed? And I do want to hand it over to Senator Irwin because I want to do a specific question to Planned Parenthood afterwards that kind of brings up after trying to support legislation such as this.
Great. Well, I mean, I think the first order of business and the easiest thing for folks to do is just to reach out to their legislators and ask them to support the legislation. It can be incredibly powerful when one of your constituents, one of your bosses, one of your direct reports reaches out to you either over email or over the phone or at an event like this or in real life. And when that person just asks you a question and gets you to engage with the issue. I think that's particularly important with this issue because, I think there's really only one right answer to the question. Do you support universal access to these important over-the-counter contraceptions, and do you think that these cost barriers should be removed? I just think there's incredible power in asking that question. So, get involved, ask your legislators, encourage them to support the legislation. Second off, before you pass it to Planned Parenthood, I want to give a plug for, these organizations that are on the call, whether it's, organizations like ACOG or organizations like Planned Parenthood. The attacks on reproductive health have been increasing, and it's a scary time. And so I think that one of the things we need to do as a community is just link arms and support and join and be a part of raising our voices together, because that can really take those efforts that are individual and show that there's this incredible groundswell of support for equality and justice in the reproductive space.
Yeah, I'd have to just agree with all of that. First and foremost is not only calls, send a letter, House representatives to your senator, no matter who it is, just let them know it's important, because we can't ignore emails and messages and phone calls. And so I would highly suggest that. And second thing, again, exactly what I would have said is we need to be allies on a lot of these issues. We need to band together. And it's not just a women issue. And so I think it's an everybody issue. And this is about our families, our brothers, our sisters, our aunts and uncles, and it's about us. So I think we really need to humanize these issues. And I think that's why we need to really talk about legislation and how it's going to really impact some of the patients that we see, some of the advocates that we see in our own personal stories. So talking about advocates, I do want to hand it over to Planned Parenthood a little bit about what you believe people can do to kind of push legislation such as this.
Yeah, I absolutely want to echo what our two senators said. Reach out to your representatives, your senators, let them know that that these bills are important and they're coming up, and that you support them. If you become a member of Planned Parenthood Advocates of Michigan, we will send you a direct link that you can fill in some forms and it'll send an email right to your representative. So I highly encourage that. And also just you can follow us on social media, subscribe to our email list, and we also have links there as well. But the most important thing is to reach out to your representatives, tell your friends to reach out to their representative, share the word, and yeah.
So this is open up to all. Oh, go ahead, Senator Irwin.
I was going to add one more thing on that, sharing the word. I mean, I think it's important to reach out to your elected officials, but I think it's also important to reach out to your friends and families. When I've heard the word humanize a couple of times, it reminds me of how often discussions about reproductive health get reduced to almost this like comic book level of unseriousness and lack of nuance. And, I think that it's highlighted when you hear national debates about these issues where you hear nationally prominent figures talk about these issues in ways that seem completely divorced from the medical realities that people have to deal with. And so the more that we can tell those humanized stories of people and how these challenges have affected their families and how it's affected their path towards becoming parents or how some of these cases become challenging and complicated. the other side really wants to take all that nuance away, and I think it's part of our job to show that this is a human story, and the individual circumstances that people are facing are important, and that's why it's so important that those individuals have the freedoms that they should have in any free country.
Yeah, and I think you touched on something really important. And actually, the next question that I want to pose to all of the panelists is we're going to hear a lot of information, misinformation, and counter arguments on some of these bills on what opponents might say on these bills. So what are some things that you guys might have heard in the past or might want to prepare of what we might hear and how to counteract that information, misinformation?
I think the first thing I think of is when people say that emergency contraception is like an abortion pill. It's not. Neither is the O pill, neither is like birth control pills. They have nothing to do with that. They're also like not even the same medications that would be used. So I think that's something that's used as like a pretty big scare tactic, especially like in this polarizing time. So I think it's very important to realize that they're two very, very separate things. If that is a line, for example, for a constituent, you can know that line still exists. And this issue is still something that's very firmly separate from something that would cause an abortion.
And another thing that I think might come up, as we discussed before, is safety. People may be using this information to go after, oh, well, this isn't safe. We don't want to be providing funds for something that's unsafe, but just making sure that we're using good evidence-based data that's published in respective journals, the Journal of Obstetrics and Gynecology, the Green Journal, the Gray Journal, New England Journal of Medicine, using validated resources to support evidence-based medicine. So I think using that it will help prevent misinformation as well.
I agree. And I think one thing that I even learned from this is just talking about it in layman's terms is that, you know, there's other reasons why people take it. And it's available for everybody, but it just depends on your economic status. So I don't think it's either or, because it's already happening. It's just not available for everybody. So I do really want to stretch that and the misinformation about being not only abortion pill, but only having it to family plan. Like I mentioned earlier, is there's several other avenues and reasons why we have medication. And so I think, you know, to steer away from some of that negative and misinformation going that way from these. Senator Irwin, did you want to add anything?
I mean, the only other argument that I've kind of heard a little bit is just around cost. You know, anytime that we require insurers to cover anything, presumably there might be a cost to that. But I think on this one, we have to balance that cost up against other costs that are borne out by the system that we all support through our premiums. And I think on this one, there's a pretty easy argument to say that this is not going to add to costs. Obviously, pregnancy and carrying a child to term can be extremely expensive. And so, and I also think that given what we've heard from the doctors and what's been shown in the research about the safety of these substances, these drugs, shows that those concerns, I think, are going to be minimized.
Thank you.
Yeah. Building off that, insurers add medications and procedures that are covered under policies all the time, so it shouldn't have any major effect.
I like that. It shouldn't have any major effect. I think I want to do another question that's open for everyone, because I did start off this webinar saying we've done a lot in reproductive health. We're trying to do freedom to plan with this legislation, but there's still more. So I do want to leave a little bit open to some experts on what are other contraceptive issues or reproductive issues that aren't covered by this bill that you might want to see done legislatively in your own experience firsthand. We'll start with Planned Parenthood.
Yeah, actually, we have a package of bills similar to these ones about contraceptive equity over in the House at the moment. And so I am hoping folks can get involved in that way too and kind of pressure some of your representatives to support those, because once those pass the House, they'll be over to you, senators, and I know where you guys stand, so that's great. Um, Going forward, I mean, I think there's 7 or 8 bills in this whole contraceptive equity package that we have going on. So that's a lot on PPAM's side of things. But I would love to hear more from the doctors on the call where they think we should head next.
Thank you.
I think absolutely we need health insurance coverage for terminations, 100%. I can't tell you how many times in the last year that we have a group of physicians who are abortion providers in Southeast Michigan. We connect with each other to try to help patients. And so insurances, both private and public, only cover terminations in the setting of threat to maternal life, rape, or incest. This leaves a huge category out of that, and that's fetal anomalies. We have a lot of patients who are diagnosed with severe fetal anomalies, lethal fetal anomalies, where insurance will not pay for a termination. This is heart-wrenching to me that a company would prefer a pregnant patient carry a non-viable pregnancy to term, only to have that pregnancy pass away immediately, maybe suffer a horrible kind of death in the process. But either way, it should be a covered benefit of insurance, whether there's a lethal fetal anomaly, whether there's a fetal anomaly that's not lethal, whether the patient doesn't want to be pregnant. So I would love to see in the future a bill put forward to have insurers cover terminations.
Thank you, Doctor. Anyone else? I do want to do a plug. I know there's a lot going on with reproductive health. And Ms. Brand mentioned it, but also what's going through the House and also through the Senate is surrogacy. So just that protection, as well as just a multitude of options for the families to have through that family planning. So before we close out, I do want to do a plug that we will have a last slide up for anybody on this that wants to co-sponsor. It's a citizen co-sponsor for this legislation. They can go on to senatedems.com/freedom-to-plan act. Yep, right on there. But as we have this on the background, I do want to give a little bit of moments just for last comments from our entire panelists, and then end with Senator Irwin and myself. If you want to have a little bit of comments on just this town hall and how important this legislation is. We'll start with Ms. Brand.
I just want to thank you both for really highlighting this important issue and giving us the space and time to talk about it. We hear from members all the time that this kind of work is so important to them, and it's an easy way for them to get involved and show their support for the choices that we all make as individuals. And yeah, just wanted to mention that these bills also are in committee this week, so we're looking forward to kind of getting some movement on them going forward, and looking forward to that too.
Thank you. Dr. Sayed?
Yeah, so I think, over the years, we have made so many advances in medical care and in our ability to take care of patients and things that are safer for our patients and things that are necessary for our patients. But then unfortunately, we run into these hurdles when it comes to the financial costs of these effective medications. And it really is just the laws being so slow to catch up to the medicine and to the science that is constantly in flux. And so bills like these are so essential in making sure that our laws are catching up with the rate of change that we're seeing in the medical sphere, so that patients actually, great that we have these options, but what does it matter if patients aren't able to actually access them? And so bills like this really impact that part of things, which is access to these essential care that the patients need. And so I do really have a lot of gratitude for everyone that has been involved in creating these bills, because we as physicians really, really, really need these laws to be implemented and to be changed so that we can provide the best care possible for our patients.
Thank you. Dr. Twine?
Just kind of reiterating what my colleagues have said already, and also kind of really trying to drive home the gratitude for recognizing that it's not just getting these medications and these like options available like out in the world, but also like getting it that next step to the patient so that they can actually access it. Like, it's great that it's FDA approved, but until like someone can, like, you know, Susan can get her hands on it, like it's not really going to do anybody any good. And so thank you again so much for bringing that to the forefront, for bringing these really important issues that we can so clearly see how it's going to change people's lives in the future.
Thank you. Dr. Klein?
Just want to reiterate, thank you so much. This is so important for our patients. This is a great step forward. There is a lot of work more that we need to do, but this is a great step forward, and it's going to help a lot of people.
Senator Irwin?
Yeah, thank you, Senator Cavanagh, and thank you everybody who's been a part of this for helping us, highlight the importance of this and talk about some of the details and why it's good for Michigan. I'll just repeat the words that we've seen all this advancement in science and medicine, but the barriers continue to be, financial and political. I just thought that was an incredibly wise distillation of what we face in a variety of different spaces, from climate change to reproductive health. But, that's why I think it's so important that as we move into the season here, that we continue to talk to our friends and neighbors, that we continue to join organizations that are doing good work, not just in advancing the science, but also groups like Planned Parenthood that are out there advancing the political conversation about, what are we as a community, what do we want to be, and how do we break down some of these barriers that are financial and political around reproductive justice. And so I'm incredibly proud to be a small part of that effort and to join with all of you to do that, and specifically to be pushing the legislation that says that folks who access their health care through Medicaid, they deserve the same sorts of opportunities and treatment as folks who have private insurance.
Thank you, Senator. And lastly, I just want to thank each and every one of you, not only for agreeing to be on here, but your words of expertise, your background, your history on this legislation and this topic, and for what you guys do every day. Seeing these patients and being the advocates on the boots on the ground, it really does the work, because legislation like this, I know I say it all the time, is like, I love doing legislation in Lansing, but I really, really love doing legislation that is going to have tremendous impacts to the people and the constituents I serve. And I think this legislation is exactly that. We're going to see profound impacts the minute that it's hopefully immediate effective. We'll do some work on that. I just think that this legislation will change lives, and it's life-saving. This is the freedom to plan your family, freedom to plan your life, freedom to plan your future. And so I thank you guys for joining. Thank you everyone for joining in this conversation and listening to us tonight. Thank you, Senator Irwin, not only for tonight, but introducing this legislation with me and trying to push it through the Senate before the end of the year. So let's get to work. Thank you, everybody, and good night. Have a good one.
Thank you.
Thank you so much.